Life in a pandemic, in a new year, very little comes as a surprise anymore. No questions can be asked too many times, and the answers can change by the day or even the hour sometimes, because we're always learning new things about coronavirus. So as we get closer and closer to widespread vaccinations, we want to make sure that you feel prepared for when it's your turn. Tonight, we're answering your questions about the vaccine, testing, surgery in a pandemic, and much, much more as we work with each other for a brighter future ahead. We Together, a coronavirus discussion.
And thank you for joining us for our special tonight. I'm Molly Pat. I'm joined by two experts in this pandemic from Stormont Vail Health, Dr. Wael Kreis, who is a general surgeon at Stormont Vail, and Tracy Duran, who is a registered nurse and the director of medical and surgical. So thank you both for being here with us tonight. We do have a lot to get to, and the time together, it does go really fast. So real quickly, I want to give an update on the latest numbers and trends that we're seeing this minute. So first, a look at the numbers in Kansas. More than 250,000 people in the state have tested positive since the pandemic started. 3,500 people in the state have died from the virus, and right now more than 850 people are in the hospital fighting the virus in Kansas. Now looking at the latest coronavirus headlines now, data from Johns Hopkins University shows that more people could die from COVID-19 in January than in any other month of this pandemic. Plus, as a part of the hunt for new coronavirus variants, an international database shows the United States ranks at 61st in how quickly virus samples are collected from patients, analyzed, and then posted online. And an emergency doctor in D.C. says that vaccinated grandparents who want to visit with family who haven't been vaccinated can safely meet outdoors with everybody 6 feet apart. And the state of Kansas is moving up in the ranks in how quickly it's distributing its vaccines compared to other states, according to the CDC. Previously, we were in the bottom 3 of the list. Kansas now comes in at 26 for vaccines administered per 100,000 people. In total, the state has administered over 77,000 vaccines as of today. Kansas is ranked 33rd for the sheer amount of vaccines that we've been given. And our most asked questions for the last 2 weeks are all about vaccine rollout. Why is it so slow in Kansas? When will it be your turn, and how do you sign up? So we are working hard to get those questions answered. We've invited the governor and state health secretary to join us tonight, along with our Stormont Vail experts. The governor was unavailable, and the state health secretary did not respond. With that being said, though, we are still going to talk about the vaccine. That's what about 90% of what our viewer questions are about. So we're still going to get to those. So let's get right to it. I'm going to start with Mr. Rand, and we'll check back in with Dr. Kreis in a minute here. So first, just tell us how communication is going with the state on vaccinations for your staff and moving towards widespread vaccination.
Yeah, that's a great question. So we have been in very close contact with the state on how many vaccines we will have, when we can give those vaccines, and who we can give those vaccines to. It's really important to know that that's really dictated by our state and our government officials, and they're doing a great job with that. But we are just trying to figure out how to implement that. So we have lots of teams at Stormont that will walk through how we can get those to the public once that becomes available.
And so on that note, let's go over the final distribution plan that was actually just released by the state a few days ago. There's still five phases. The first, which is what we're in right now, vaccinating all healthcare workers, residents, or patients in long-term care facilities. Phase 2 includes anyone 65 years and older, along with firefighters, police officers, grocery store employees, K through 12, the school staff, people who live or work in homeless shelters, child care, emergency shelters, or correctional facilities are also in Phase 2. Now, as for Phase 3, people who are 16 to 64 years old who have high-risk medical conditions like cancer, Down syndrome, type 2 diabetes, and pregnant patients are just a few, along with workers involved in agriculture, utility, transportation, water systems, and communications. Then Phase 4 gets us into people 16 to 64 with other medical conditions like asthma or liver disease. And then finally, Phase 5, it gets us to the rest of the population for everybody 16 and older. So, Mr. Rand, a popular question from several viewers, this one specifically, though, from Vivian Brendan. She asks, will people in Phase 2 be notified when we get the vaccination? Will we need to make an appointment? Where will they be administered? I know you're still working out the details with the state, but can you answer any of those based off what you know?
Sure. We are still working those out for the state. As far as who we can or how you will be notified, that's still to be determined. But there is a team at Stormont that's working very diligently on that. But when it is your turn to get the vaccine, and we really do encourage you to get it when it is your turn and when you get that call or ability to sign up. And there's just a really great process over at the event center where we can drive up, you walk in. I just actually did it on Friday, and it was so smooth. We came in, I was in and out within 20 minutes, and 15 minutes of that was them monitoring me for any symptoms. So it was very quick, the registration to the paths that you walk down. So once you get that call, they will have everything lined out for you, since we've been doing it for a few weeks now.
And so, Mary Holiday, this is a good one on that note, using all of those resources to make it easier. She wants to know if you will be using MyChart for notifications or scheduling when vaccines become available to people in phase 2. If not, how will people be notified and schedule appointments? So will they be getting a call, or do you know if people will be using that MyChart? Obviously, people are familiar with that.
That's so great to hear that people know what MyChart is and they're using that. That's been a positive thing that's come out of our pandemic, because we really wanted to use MyChart to get information and healthcare resources out to our community. So I think that that's a great question, and again, they are working through how to notify them, but I can almost guarantee MyChart will be a part of that. So if you haven't signed up for that, it's a good time to do so.
And do you know if people get a call, let's say they decide not to go get their vaccine right away, will they be able to go back even if they missed their term when they were ready for phase 2? Can they go back in phase 4?
Sure, yeah, that's a good question. And right now the problem is that there's only a limited supply. So if you do skip it, yes, there'll be another time that you can go back, but we don't know when those vaccines will be available to us, because we only get a certain allotment. So you shouldn't push it back just a couple of days to meet a meeting or a special occasion. But if you do decide that for some reason it's not the right time for you, your time will come back around again.
Okay, so let's talk about the vaccine itself. First, both Pfizer's and Moderna's vaccines, they're overall really similar, correct?
Correct, yes,
yeah,
very
so
similar.
The biggest difference being maybe the temperatures that they have to be stored at.
Yep.
So Eric B. wants to know what happens when it's time to administer the vaccines. How long do they need to thaw? And after that, how long are they good for? What if people skip their appointments, kind of like you were talking about? How will we prevent waste of the vaccine?
So we really try to just make sure that we have enough for that day open, and then if we have more at the end, then we find the areas that we can give those vaccines, because once we open a vaccine, we do have to give those for that day.
And so is there an expiration date on the vaccines? Is it a few hours, a few days?
Well, once we open it for that day and it's come out
Okay.
of the refrigerator, then you have to use it for that day. Yes.
So then do you guys know what you'll be doing with, if you have extra for that day? Is it kind of, you just get rid of them, or what
Oh, we
happens
try
there?
really hard not to do
Yeah.
that. So there's a lot of great teams that are working with this, and they have processes in place that they can make sure that they're using all the vaccine, and we are not throwing any of that away.
Okay, so do we know yet how long the vaccine will protect us from COVID-19 once you get it?
We don't yet. We're hoping to get more information on that as the year goes on, but for sure we know that it'll last us for this year once you've had both shots.
Okay, so a new report is showing that the second dose of the vaccine will produce a stronger reaction to whatever side effect you maybe felt during your first dose. So if you had a sore arm, it might be a little bit more sore after you get that second dose. Can you explain why that happens? Is it your body just really building protection, and what experience did you have when you got yours?
That is a good question, and we have, some people did have a pretty strong reaction. That's actually a good thing. That's an immune response to the vaccine. So that's a good thing if you have a reaction. It doesn't mean that you have COVID, but you can experience symptoms from 24 to 48 hours. What I'd really encourage people to know is that I think that has gotten out to everybody that, you get sick from the vaccine. It's not really true. More people don't have anything but a mild arm ache. For my experience, I had a little bit of fatigue after my first shot. I had my second shot on Friday, and I really experienced no symptoms besides a sore arm. I did have some soreness at the injection site the second day, but the third and fourth day I had no symptoms.
And once you get the vaccine, I know that I've talked to some people who are getting text messages, asking about their symptoms. Can you talk about how important it is for people to reply to those? Just studying all of this stuff right now, we need all the information we can get.
Sure. So you're talking about the V vaccine from the government, and that is a place that you get a text message every day. I actually did mine in your waiting area out here. I got the text message. They said it's time to report your symptoms. So you can report that I had a mild pain in my arm? Did I feel feverish today? My answer was no. And did I have anything that prevented me from doing my normal daily activities? So I said no to that. Even if you say yes, the questions take maybe 1 minute, 1 to 2 minutes. So it's really ideal that we get that information sent back to the CDC so that they can say, this is our likelihood of getting a fever or making those connections.
All right, we're going to take a quick break here, but when we come back, we're going to talk about testing, masks, and surgery in the pandemic. Of course, we have more vaccine questions as well. We'll be right back.
We Together, a coronavirus discussion sponsored by Stormont Vale Health.
Frontliners, essential employees, heroes. We've been called many things during this pandemic, but the truth is, we aren't your first line of defense. That title belongs to you, your neighbors, and your community. By wearing a mask, washing your hands, and social distancing, you can keep us safe. Care for others, so we can care for you. Stormont Vale Health, empowering you together.
KSNT News and the Jefferson Awards are honoring unsung heroes and communities all across Northeast Kansas. Every month we recognize deserving people who go beyond what is expected to help those in need.
It takes everyone to make this work.
I just started volunteering for stuff.
If you know someone who is making a difference, help us shine a light on their service. Go to ksnt.com to nominate them today.
The Jefferson Awards, sponsored by Azura Credit Union. The KSNT Storm Track Weather Cam Network, a live exclusive look at weather across Northeast Kansas, providing you advance warning of changing conditions. The KSNT Storm Track Weather Cam Network, sponsored by Prairie Band Casino and Resort. KSNT News, Kansas Association of Broadcasters' Best Prime Newscast, Best Local Weathercast, and Best Local Sportscast. KSNT News, local news that matters.
COVID-19. Will I get it? Will I survive? COVID is scary, but there's one place you should always feel safe. At Stormont Vale Health, our hospital and clinics are taking every precaution to make sure you can still receive your routine and elective health care quickly and safely. Our emergency department with a level 2 trauma center is still the best place for emergent care. COVID-19 is scary, but receiving your health care shouldn't be.
Welcome back to our coronavirus special discussion tonight. If you're just joining us, we have two experts from Stormont Vale Health with us tonight. Tracy Duran, who is a registered nurse, and Dr. Wael Kreis, who is a general surgeon. Dr. Kreis, you even just got out of surgery.
Yeah, I did. Thank you. Molly, thanks for having us today.
Thank you for being here. So let's first get started with, talk about, are we back up to speed with daily surgical procedures? At the start of the pandemic, it was kind of all put to a stop.
Yeah, so back in March, April, when we were not sure what we were dealing with. There was a lot of uncertainty. We did, put a stop to almost all non-emergent operations to try and figure out what the demand is going to be on our, staff, our resources, our, ICU, and, ventilators, knowing what we knew from New York and Europe. So for a while we did put a stop, but once we realized that we had the proper resources to take care of our patients, we did gradually reopen back our operating rooms to take care of our patients and our community. So right now we're trying our best to address all our patients' needs in a timely fashion, and of course in a safe and effective fashion as well.
Yeah, and how was that, getting everybody rescheduled and taken care of again once you went back into full operation? Yeah,
to be honest, the first week or so after we went back to full operation, there was a lot of patients waiting, what we call a backlog of operations that needed to be done. And we went through these operations, the surgical team with the anesthesia and the leadership of the hospital, looking at what is more urgent that needs to be addressed first, including cancer operations, including patients who have severe symptoms that need to be really addressed first. And we started with those patients first, and then once we got that, those patients really addressed and taken care of, we started expanding to almost everyone who was waiting.
Yeah, that totally makes sense. So you're also a bariatric surgeon, and usually at this time we're talking about the flu nonstop. So is it possible for people to have both the flu and COVID at the same time? Any comorbidities that cause concern with COVID?
This is an excellent question. There have been multiple recent articles actually in the scientific and medical journals talking about patients who are morbidly obese and contract COVID or severe flu actually have a higher rate of being hospitalized, being in the ICU, requiring ventilator use, and also having worse outcomes, including death. So definitely, the American Society of Bariatric Surgery and Metabolic and Bariatric Surgery, as well as the Society of Obesity in the U.S., have actually recommended that bariatric surgery not be considered as an elective operation and actually considered as a time-sensitive operation because, again, the literature and the research has shown that doing these operations can give these patients better outcomes if they ever contract the virus.
And is that a concern moving forward as well? We know that everybody's kind of cooped up at home too, so it's harder to stay active, and especially as long as we've been at home too. So is that a concern for you all after this?
Yeah, of course. It made it a bit more challenging. We do have a very excellent weight management clinic, and the first couple of months after the pandemic really hit us hard in the States, we were having difficulty getting our patients to come to the clinic, make sure that they're adhering to the diet, the exercise. Also access to healthy food was also very difficult at first, and it was easier to order, and go get takeout unhealthy food. So for a while, we did notice that we were having more difficulty getting some patients to adhere to those recommendations, but we worked very hard, and we're still working very hard on making sure that we keep working with our patients to get the best outcomes.
Is there anything new that you all are doing before you go into the ER for surgery now with COVID, and then is there anything that people should know that they need to expect extra steps to do?
So there's multiple pathways that have been written up, and protocols that have been written up and actually are disseminated in our organization regarding patients requiring emergent versus non-emergent operations. So an emergent operation, they have to undergo a screening questionnaire themselves or their family, and if they do screen positive for signs or symptoms of COVID, then and everybody gets tested, of course. Then they go to a specific operating room that's well equipped with negative airflow for COVID patients, and everybody who's in the operating room is wearing N95 mask, wearing what we call a PAPR, which is a airway sterilization device, and again that operating room is well equipped with negative airflow for COVID patients. For everybody else, any elective or scheduled procedure, we do ask the questionnaire and everybody gets tested. So if you are getting, let's say for example, gallbladder surgery scheduled, but you test positive, then we might consider rescheduling the operation until you pass your 10-day quarantine as recommended by the state. If on the other hand you have severe symptoms and you tested positive, then we will have you get in the hospital and go through the COVID positive approach, because at the end of the day, if you're having a lot of pain, this is affecting your quality of life, you need the operation, this is not considered elective anymore, and we'll have to deal with it.
Yeah, that definitely makes sense. All right, we're going to take another quick break here, but more questions to be answered are on the way. Stay with us.
We Together, a coronavirus discussion sponsored by Stormont Vale Health.
So that rash or spot you said I should keep an eye on, it's definitely getting worse.
Okay, let's take a look.
Ew.
There's definitely some swelling. Is it warm to the touch?
Yeah, it's pretty warm.
Okay, well let's try a prescription ointment. Is that a Justin Bieber tattoo?
Okay, gotta go bye.
Stormont Vale now offers virtual care, so you can talk to your doctor almost anywhere. Download the MyChart app to get started today.
Frontliners, essential employees, heroes. We've been called many things during this pandemic, but the truth is, we aren't your first line of defense. That title belongs to you, your neighbors, and your community. By wearing a mask, washing your hands, and social distancing, you can keep us safe. Care for others. so we can care for you. Stormont Vale Health, empowering you together.
Are you questioning what to do about your education? Whether you're considering a bachelor's, master's, doctorate, or even a certificate program, Baker offers small class sizes, faculty with real experience, and a community that's well connected. We aren't going anywhere. Are you?
The news that matters to you is on KSNT News.
KSNT News was first to tell you Manhattan's Little Apple ball drop was canceled. KSNT News brought you in-depth coverage during a fire at a former Topeka mall. KSNT News had a team of reporters and meteorologists in early to help you safely navigate winter weather. And KSNT News brought expert doctors in to answer your questions about the coronavirus.
When you want to know what's happening now, count on KSNT News, local news that matters.
This week's Pets in Need Spotlight is Peanut. Peanut is almost 4 years old and our first Krabby Tabby graduate. She likes attention but doesn't like to be held. She is $50 to adopt. You can meet Peanut by appointment at Helping Hands Humane Society.
We are back for our final segment in tonight's coronavirus special, so we want to get right to it again because we only have about 10 minutes left. So Mr. Duran, George Bales, it says that there have been a lot of advertising requesting people to take a free test for COVID-19. He's asking why I should get a test if I don't have any symptoms.
That's a great question and one that's a little bit difficult to answer. So we want to make sure that we have testing available to all of Kansas and Shawnee County. And so the state's really stepped up by giving these free COVID testing sites. So that's great for them to have. And we want anyone that has any kind of symptoms to go and be tested. The hard part is when you don't have symptoms, there is a less likelihood that it will test positive. The sensitivity is not as good when you don't have symptoms. So random testing isn't probably as much encouraged as we would like you to always get tested. If you just maybe think that you're having allergy symptoms, that's a great time to go get tested, make sure it's nothing more, because they can be disguised as just a sniffle and sore throat that we normally would have pushed off, but we want to make sure that we stop the spread.
Is that kind of the difference between the PCR test and the rapid test? If you don't have symptoms, that PCR test might show it better than a rapid test?
No, not necessarily. The testing isn't as the issue with sensitivity. The sensitivity is more of do you have symptoms or not. If you don't have symptoms, the test is less sensitive.
Okay, so Mr. Bales also wants to know which COVID test is better on that note, the one that goes in your nose or the saliva test that we're seeing more of.
So there's pros and cons to both, and so I would always go back to your healthcare provider and ask them what is best for the symptoms that you are feeling. They've really done a lot of good work. In the beginning, we really just encouraged nasopharyngeal, which is the one that goes pretty deep up into your nose. That's what we encouraged, but we've really been able to increase the test sensitivities, and really they've all stepped up, and most tests are pretty good now.
And Dr. Kreis, what are you most concerned about post-COVID life when things go back to normal? I know we touched on this a little bit, but are there the other health concerns that you worry about? Is there anything that people can do now to kind of avoid those things from becoming bigger problems?
Great question. So what I would recommend and what the medical communities have been recommending is if you have any medical concern, do not be afraid to seek medical attention right now, because to be honest, you know, the hospital is probably one of the safest places to go, or your medical care provider's office, one of the safest places to go to and address these concerns. You know, everybody in the hospital is wearing their appropriate PPEs, getting, you know, everything is, you know, sterilized and clean. And if there are medical concerns, anything you worry about, anything that could, you know, weakness, fatigue, pain, anything that could be alarming, we don't want to put this on the back burner, and then once COVID or everything is hopefully comes back to normal, we end up with medical issues that are too late to address at that point. So if you have any medical concerns, please seek medical attention and do not wait.
Yeah, don't delay, just go over there right away. So Mr. Duran, when do you think that we will be in that widespread vaccination period? I know we've talked about you're working with the state, it really depends on them. Our biggest question is when. People just want, I feel like, a sense of timeline and something to look forward to. So can you give any insight and ease some minds on that?
Sure. You know, I've been thinking a lot lately about that cartoon that's the gold miner and he's chopping through the earth, and we can see just right on the other side is that gold mine, and he's almost there. And I kind of just keep telling my staff that that's it. Don't give up. Don't back off on your mask. Don't back up on your 6 feet of distance. You know, still stay with the same recommendations. And the vaccine is coming. We're getting great allotment in the state, and I think we'll be continuing to get more and more. And now that we have 2 options with Pfizer and Moderna, everything's looking up, and I think that we'll be in a good spot here in the next 6 months.
And then just within the last 10 minutes, too, K-State actually had to cancel a basketball game for Wednesday because too many players tested positive for coronavirus. So what does normal life look like to you? You know, somebody on the inside of the hospital, is it, you know, are we going to see these games and these events continually be canceled, you know, time and time again?
Honestly, I hope that we do continue for a little while, because that means that we're still holding the recommendations up. And so I commend them for keeping everybody else safe if they are experiencing a high positivity rate. But we'll get there in life beyond this, when we aren't scared to hug our parents and to be with them and eat dinner so that we have our masks off. It's coming, and we really truly feel that the vaccine is the way to get there.
And Dr. Kreis, what can you tell us about what you've read or understood about the new variant of coronavirus? Is it here yet? Are we just now figuring that out, or is it not here yet? Kind of what should people know about this?
Yeah, I know, you know, so when this first came up in the UK, I think over the past 10 to 14 days, there was definitely a lot of concern, and the government in the UK did a very appropriate job with, you know, cordoning and quarantining people who had the virus. There have been isolated incidents, as far as I know, and you probably have more information, you know, with the national news. But there have been isolated incidents of the new variant of the virus. The vaccine companies, you know, the pharmaceutical companies, are actually actively looking at whether this new variant will be covered or not covered by the vaccine. But so far as I heard over the past 10 days or so, is the vaccine should cover these variants. But again, we do not have any any solid recommendations or any solid information yet. So yes. Time will tell.
Yeah, the novel coronavirus, we're learning new things day in and day out. Well, okay, Mr. and Linda Galloway would like to know what you suggest to people who have coronavirus but don't necessarily need to go to the hospital, just want to feel better. So any home treatment ideas for folks out there?
Sure, that's a great question, and one I actually just gave today is water, water, water. Stay hydrated. The worst part of your fever is that when you think that you've drank enough water and you are hydrated, you're probably not, because of that fever is dehydrating you as quickly as you try to hydrate. So anything over the counter, Tylenol, ibuprofen, and lots of water and fluid.
And Dr. Kreis, obviously a lot that is still being studied out there about this virus, like we say, but is there anything that really sticks out to you that impacts everybody that's being looked at about the virus that people should know that's maybe not talked about as much?
Well, I think based on our previous discussion, the most common the factor that's associated with the highest rate of complications from the coronavirus is actually obesity and its related comorbidities. So I think we have to look at this also in the future as a way to combat obesity and the trend of obesity in our adolescents and teens as they go into adults, because again, those patients were the ones that had the worst outcomes when they got admitted to the hospital. Also, I think to be really aware of, and I think that will come up in the future when we look at this retrospectively, hopefully.
Yeah, definitely far beyond this. Well, okay, I'm going to give you both. I want one sentence from each of you about if you want people to take away one thing from tonight, everything that you've covered in one sentence, what would it be? Mr. Ann, I'll have you start.
Don't give up. We're getting close.
All right, Dr. Kreis, what about you?
And again, please be safe, please practice social distancing, wear your masks, and again, the future is bright, we just have to hang on for a little bit, and we'll all be good.
Awesome. Well, thank you both so much for joining us for this coronavirus special, and thank you all for watching tonight. But keep sending us in your questions as well. We continue to work to get those answers. We will not stop, so you can email coronavirus@ksnt.com. I am personally reading all of those emails as well and bringing them straight to the experts and the governor and the state health secretary. So continue to send us your questions. We will keep working to get answers to those. Thanks for joining us. Have a good night.